The next speaker is a very enthusiastic friend of Lavori and Corso. I have to say, always present, and is the first to answer, yes, I want to present something. So really thank you very much, Professor Marco NARICI. And today, if the, okay, this is the last version, fantastic. I thought that it was the fourth title. He will present effect of focal muscle vibration on muscle mass and function following 21 days of bed rest. Thank you very much.
Thank you, Gaspare, and a big thank you to both you and Alberto for organizing once again the Lavori corso, to which I participate with extreme enthusiasm, as you know, having grown with Alberto here in this institute many years ago. So yes, I will be talking about the effects of focal muscle vibration on during 21 days bed rest in males. Why are we interested in this? Because so far, as many of you in this room know, the content measures that have been proposed for preventing loss of muscle mass and functional space has been mostly focused on the motor system, on preventing the loss of function and of the motor system. Whereas less attention has been given to the somatosensory system. When we are exposed to spaceflight, we face a condition in which there is a reduced proprioceptive drive. Yeah? There is a reduction in proprioceptive input, and this is due to the fact of the lack of drag gravity. And in 1990, Gallivia clearly showed that if you eliminate, if you block afferent input from the proprioceptors, the motor output is reduced. It did so by anesthetizing the sensory nerves, and he observed a reduction in motor output. With focal muscle vibration, we can stimulate the sensory system. Focal muscle vibration consists of a vibration, a sinusoidal vibration, a frequency range between 80 and 100 Hertz, and an amplitude of 0.2 to 1 millimeter. And this causes micro stretches on the muscle spindle, causing a dramatic increase in 1A afferent discharge. And this amplitude is not sufficient to elicit the tendon vibration reflex. This has been shown by John Rockwell and colleagues. The afferent signal that travel through the 1A fibers reach the primary somatosensory cortex, causing increased activity, and this results in improved gain, accuracy, and disinhibition of the motor commands in the primary motor cortex, what is called a sensory gain regulation. Thus, enhanced proprioceptive input to the primary sensory cortex improves sensory motor integration and reduces inhibition constraints on the primary motor cortex, thereby increasing corticospinal drive and voluntary force production. Also, the high frequency input, the temporal regularity, and the repetition time involved in the focal muscle vibration trigger what is called a long-term potentiation, which is light effects inducing Hebbian plasticity of sensory motor circuits, leading to increased synaptic efficacy, expansion of cortical representation of the vibrated muscle, and lower activation threshold. These effects can last from hours to days. And we applied focal muscle vibration as a countermeasure for neuromuscular impairment during 21 days bed rest. With a group of 20 male adults, 10 underwent just bed rest, and 10 underwent bed rest plus focal muscle vibration. And we applied the protocol that I just described. This was applied for 30 seconds, repeated 3 times, with 1 minute here of rest in between. So the total duration was 210 seconds. After 10 days and after 21 days, we measure muscle size by MRI, we measure muscle strength with the dynamometry of the knee extensor muscles, and we also took blood samples and muscle biopsies. This is the setup. It consists of an actuator module, which is applied to the limbs, which you can see on the left. The application of the actuator, and this is the control unit that delivers the protocol. And these are the results we found. We found, which we expected, a lesser decreasing force induced by the focal muscle vibration. This has already been described in literature, not applied to bed rest, but in patients. But we were very interested to observe that there was also mitigation of muscle atrophy. This was evidenced by MRI of the quadriceps muscle. So from this observation, we conclude the following: that focal muscle vibration as a countermeasure seems to mitigate the loss of muscle size and force caused by bed rest. We think that the protection against the force loss is the result of the improved gain, accuracy, and disinhibition of the motor commands on the primary motor cortex, and also by the long-term potentiation by the reduced, and also by the reduced atrophy. Whereas the protection against muscle atrophy suggests that the focal muscle vibration acted upon the muscle mechanoreceptors, activating the protein signaling pathways, the AKT and TOP pathway, leading to stimulation of protein synthesis. And we are planning to do, in fact we are doing now a series of structured transcriptomic analysis with the hope of elucidating the mechanism behind the lesser atrophy that we observe. Thank you so much.
Thank you very much. Quite interesting, really quite interesting as a method. Manuele, do you want to add it to the spacesuit?
Yeah, maybe.
Hi, thank you for the talk. My name is Emanuele, I'm from the University of Bristol. So I'm quite curious to know, I don't know if it's part of your work or if you looked at this in the past before, how does this technique compare to traditional strength exercise that we do in space, or for example other techniques, for example like neuromuscular electrical stimulation with electrodes on the skin?
Yes, there's a distinct difference. This technique trains the sensory part, whereas most of the other systems train the effector part, so the neuromuscular part. And so there is in fact a lack of very few interventions that have targeted the sensory part. And this is despite the fact that in the space there is a sensory motor deprivation. Because the proprioceptors are less stimulated, much less stimulated.
Just a strange question, let's say. Which is the size of the length in the oscillation, and if it can be related to the cyclic length? Because what you said about the mechanosensor is quite interesting in relation, for example, to tide, that is controlling the position also of the myosin motors, and could also activate, of course, some signaling inside to the fiber.
Yes, the size is 0.1 to 1 millimeter. We don't know what is the actual stretching at the level of the muscle fibers. We hope to be able to get hold of a sufficiently ultrasound with a sufficiently high sampling frequencies to enable us to measure this. But obviously we need to go up at least 150 hertz.
Professor, to your right. Alessandro Santuz, Max Telberg Center, Berlin. I was wondering, since vibrating the muscle in this way, there are some downsides, right? So mostly we involve 1As, 2 and 1Bs, mostly they're not really excited. And also this is a purely passive way of training people, right? Nothing is moving, so we lose that dynamic part of the receptive input. Do you think that if we found a way of implementing this, that we would improve the results that you're showing, or would this overwhelm the system?
You talking about the muscle vibration that's been used in the past by Rydberger and colleagues, in which the subjects stand with the feet on a platform?
Possibly, maybe. Yeah. So no, extend to both dynamic and passive.
That type of vibration is much stronger, and it does elicit a tendon vibration reflex, whereas this is purposely chosen to be small enough not to induce the tendon vibration reflex. So I think the working principle is similar, but the amplitude of the vibration is so small in the muscle focal vibration that they are not comparable.
I know there are more questions, but you have to ask them during the lunch or the coffee break.